Well, good evening. We appreciate you tuning in and are really excited to have three very esteemed guests with us today. I'm Brian Johnson, superintendent, and obviously we all have been dealing with the COVID-19 pandemic and are excited about some potential light at the end of the tunnel, although it's critically important that we continue to take the steps that we have taken to make sure that we remain safe from the standpoint of masking, distancing, et cetera. One of the key conversations that's transpiring right now has to do with vaccinations. And obviously, over the last several weeks, we have been in partnership with One to One, who's our health provider, and have been able to host some events. And we're very encouraged by the number of our employees that have taken advantage of those events. In addition to the events we've hosted, we know that many have had a chance to go to other providers and get access to the vaccine. But over the last several weeks, we know there's also a bevy of information that has just percolated throughout the community at the local level, the state level, nationally, in regards to what the potential impacts of the vaccine are, just general questions about the vaccine. And so we recognize, we believe in deferring to expertise, and we have the benefit of having great doctors in Chattanooga and Hamilton County, and three phenomenal ones with us today. So I'll turn to them in no specific order, but we have Dr. Keith Helton, Dr. David Bruce, and Dr. Lisa Smith, who are with us today, and very excited. Thank you all for making and taking time just to answer some general questions. And I guess I'll turn to you in the order on my screen. Dr. Helton, if you want to start off, just telling everybody a little bit about yourself and your background.
Hey, I'm Dr. Keith Helton. I'm a primary care physician here in Chattanooga for 25 plus years. I'm the CEO of One to One Health and also a proud graduate of East Ridge High School and the public school system. And so glad that we can get on here and chat with you all about the safety of vaccines and how much good we think it'll do our community. David?
Hey, I am David Bruce. I'm an orthopedic surgeon in Chattanooga, and it's odd that I would be talking to people about vaccines, but I'm a medical director with One to One Health for the COVID services, along with my wife, Lisa Smith, who's also on this Zoom webinar. I was a microbiology major and became very panicky and worried when March came around in 2020. And Lisa and I poured our efforts into learning about the COVID-19 pandemic, as well as helping our healthcare providers in the community keep their practices open and keep the manufacturing within the region open, multiple schools open, and advised to keep that happening. And we've been following the vaccines along since March. Lisa and I have really poured a lot of time into this fantastic prevention device that's been offered with us. There's been a lot of hard work that really was 30 years old that culminated in us being able to treat patients and prevent COVID-19 and hopefully save lives. Of note, I feel very strongly about getting vaccines for our Hamilton County schools as the son of a 20-year veteran teacher in the state of Alabama who held his master's in education. And I'll also offer that my wife, Lisa, is the product of two school teachers and a superintendent from school district in Pennsylvania, as well as her aunt and uncle were both teachers as well. Lisa.
Well, thank you, David, and good afternoon, everyone. I'm Lisa Smith. I'm a pediatric surgeon, but more than that, in this setting, I am also one of the medical directors of COVID services at One to One. It is my opinion, in addition to ditto with everything that Keith and David had said, we know that Dr. Fauci goes on TV every day, or almost every day, or a lot. But one of the things that Deborah Birx did, you may not have seen her as much as you did Dr. Fauci, and you may have different opinions about some of the other people you've seen on the media. But what Dr. Birx did is done a grassroots approach. To me, this is the third event I'm doing like this today. This is my 7th time doing something like that this week, and it's only Wednesday. And I think this is the most important thing. It's my opinion that if you have questions, somebody who's done a little bit of work preparing and learning about it should be able to answer it to you so that you can make your own decision. And we believe that. And so we're here today for that very grassroots reason. And so whatever you got, we'll try to answer.
Well, again, thank the three of you for taking time and spending this time with us to answer questions. And I will pivot to Kate Skonberg, who leads our engagement work. And she has some questions that I believe have been submitted and those that continue to come. So Kate, if you want to take it.
Yeah, hi everyone. So we did take some of the questions that you all submitted in your registration. So we'll start with those to get the conversation started. But you'll see at the bottom of your screen a Q&A where you're able to submit additional questions, or if you have questions as the discussion gets started. So one question that we got frequently was, if I have had COVID-19 already and recovered, do I still need to get vaccinated? And if so, how long do I need to wait to get the vaccine?
Is this like Jeopardy? Go ahead, David.
Oh, well, it's a great question. I will answer multiple questions with this answer, hopefully. And I will tell you, Lisa alluded to this. Dr. Birx went through 43 states. I think she put 35,000 miles on her car, driving all over the United States. An incredible journey that she took, and got a lot of governors to respond to this COVID event. But as far as the questions is concerned, if you've had COVID-19, you will generate an antibody response. It can be mild antibody response. It can be a large antibody response. But we do know that the vaccines themselves offer about a 4 to 10 times amount of immunity that you would get if you'd had COVID-19 and did not have a vaccine. And what we're concerned about with vaccination is durable immunity. And what we mean by that is immunity that lasts, more than a year, more than 2 years, hopefully 5 years. That you've taken your measles, mumps, rubella, and we know that those have high titers for up to 10 years with those. And we're even hopeful with this vaccine that you're going to get it. You will not get that type of immunity from having had COVID-19. It just is not a durable immunity. You have to have some form of a vaccine that will allow that large amount T-cell immunity to form.
Great, thank you. And you may have answered that in there, but will this require an annual booster?
I will go back to that. So we have some information related to SARS-1, MERS, even Ebola, because these platforms have been used for those, and including Zika. And if you go back to SARS-1, that immunity is at least 5 years from the vaccination that was used with it. And it's a very similar type of immune response that's generated by this vaccine, or at least the 3 that we have currently. And so the hope is that we're going to get at least 2 years, but I do suspect we will have to boost. I can't say whether it's going to be 2, 5, or 10 years, but I suspect we will have to boost.
That's great. It's sort of along these lines. One question we got is, after getting the vaccine, will I test positive for COVID-19 on a test?
I'll take that, and I'll also take the end of David's question, if that's okay, Kate, because you did ask if they needed to wait for vaccination, and I think it's going to be important to bring that back. And I know we all know the answer to this question, but it's important for everyone who's listening to understand that as long as you are out of your isolation period from active COVID-19, then you can come and get a vaccine. There is no reason to wait. All the different waiting periods are for other things related to COVID, but certainly not the active disease. So when you're out of isolation, get your vaccine. So will you test positive for COVID-19 if you get vaccinated? And that is not true. You won't. You'll be having antibodies to the spike protein, but you won't test positive for the SARS-CoV-2 infection. They're different tests.
Great, thank you, and thanks for that.
I would like to add to that too. Some people will have question whether will have antibodies, and they go get an antibody test, and then they've had their vaccination, their antibody test is negative. The antibody tests are not proven yet. We're not sure about them. We've had a real problem with that, even testing people who've had COVID-19. So we're not sure about the actual effectiveness of those tests. But one important part of that is, as Lisa alluded to, you will have antibodies to spike protein. You will not have it to the nucleocapsid of other parts of that. And so if the test is for nucleocapsid, it will not detect it. But again, you will not test positive on an antigen test or a PCR or anything like that for COVID-19 if you've had a vaccine.
Great, thank you for sharing that. So we also get a lot of questions about, if the vaccine has been studied enough and has it gone through enough rigorous testing, how do that we know that it's really safe? You might take that one.
I guess you want me to do this one? I guess I'm
But
going to be the
Keith
big
said he was
mouth on
taking the
this one.
third one, so.
Yeah, I can start with that. And, first of all, I understand everyone's anxiety and thinking this is new, but the platform's actually not new, and it's been around for quite some time. I think the initial start was in 2009. David can go through the details of this, but it's actually been very well studied. And really, I have no safety concerns or about the length of time it's been studied. David?
Yeah, I'm going to start with the J&J because that's an easy one. So the Johnson & Johnson vaccine is an adenovirus. So it's a virus that has a little spike protein that they've added to it. They use that exact same platform for Ebola, and they have over 250,000 of those doses for Ebola out, and it's widely effective. And so Johnson & Johnson basically just substituted that Ebola protein molecule with the SARS-CoV-2 spike protein, and have had great success with it. And is really successful too, because it was studied during the height of the pandemic and against the variants in South Africa. I mean, it is a robust platform. A lot of people are worried about it because the efficacy is low, but remember, it was, as Lisa and I like to say, it played against the varsity squad. It wasn't against the JV team, it was against the varsity squad. As far as the other two platforms, the mRNA platforms, they actually, the first time that was done was 1998, and it was used for targeted therapy in cancer patients. And I already alluded earlier that it's been used for Zika, Ebola, it's been used for SARS-1, MERS, and even a rabies vaccine has been used with it. And so we have a lot of experience with that platform. It's been effective. And literally, the McClellan lab, Jason McClellan and Barney Graham, who actually came up with the mRNA molecule to put into those vaccines, they literally knew they had the platform. All they had to do is know the sequence, and then they can make the mRNA to make the spike protein. And so they condensed those studies. Everybody thinks that, well, it didn't, it usually takes 7 years, and it does, to create a vaccine. They shrunk it down, and the way they did it is they did it with overlapping phases. And so phase 1 was overlapped with phase 2, and phase 3 was overlapped with phase 2, or 3 was overlapped with 2. And so they were moving that along as quickly as possible. But the biggest thing that happened, and the number one thing that nobody talks about, is this: it usually takes about 3.5, 4 years to enroll 30 to 40,000 applicants or volunteers to take this vaccine. They enrolled these people in 3.5 weeks. We were in the middle of a pandemic. I was willing to volunteer. I'm sure many of you guys were willing to volunteer. And because they shrunk that time to enrollment down so much, they got results very quickly. And if you think about it too, if you've got Ebola and you've got an Ebola vaccine, you've got an endpoint you're looking for, and it's how many numbers get Ebola or who don't. When you're in the middle of a pandemic, multiple people are getting COVID, so their endpoint only took a couple of months to get. So even though it looked shrunk down, it went through every process that every vaccine has ever gone through. And the FDA was very thorough with what they did. And these companies were required to submit a white paper that showed what their findings were. There was oversight in it. And that white paper is available for any American, any individual in this world that wants to go online and look and see exactly how many applicants were studied, how they were studied, what the results were, and it's right there, free public knowledge. And that's why I've got so much belief in these 3 vaccine platforms.
That's great. Thank you. Any other comments on that? Similarly, one of the questions that we're getting a lot from our staff is about, is from women of childbearing age. So women who are planning to have a child or might be pregnant. And just if you all can talk about the safety for them, that would be great.
I can take the pregnancy one. This is a good answer because the researchers doing the vaccine testing are also immunologists, and one of the specialists involved is
expert in maternal fetal immunology. And the neatest thing about the vaccines is that the babies that are being born are testing positive for antibodies. Don't forget, one of the main reasons your child doesn't get vaccinated early on is because they don't have a mature immune system. You really start your child's vaccination after they're a few months old. They're living on maternal antibodies. So the women who have gotten pregnant during the studies, even though Pfizer and Moderna said try not to get pregnant if you're in our trials, 55 pregnancies did happen. Those babies are being born with antibodies. And then additionally, mothers are passing antibodies on to their babies in the breast milk. There have been no associated problems with vaccination and pregnancy or vaccination and getting pregnant. And to go back to the previous question, as an adjunct to this one, vaccines like these were put in arms last spring. We're going on a year with people having results, not just since the EUA was given for us over the winter, but these vaccines have been in arms in the trials for over a year now. So we're in good shape.
I'll add to that too. The VAERS study. So when you get your vaccine, you get a QRS code that you can shoot with your phone, and you can report any adverse events. And since we've been vaccinating the United States, we've now given 51,000 as of March 11th, 51,000 per that reporting pregnant women vaccinations, and there have been 42 miscarriages. And that's a third of the rate of miscarriage among the population corrected for age. So the unvaccinated actually have a higher miscarriage rate than those that have been reported vaccinated thus far. And that's just independent reporting. Nobody can manipulate that data. That is just something that the individuals who've been vaccinated report.
Okay. So another question that we hear a lot is, will the COVID-19 vaccine alter my DNA?
I guess I'll do that. So we have 3 different vaccines. And so, the J&J vaccine's a little bit different. It is a viral-based vaccine that's been attenuated or basically made not capable of spreading, and it has the spike protein. And then we have the other 2 vaccines that are mRNA-based. There is no difference between the Pfizer and the Moderna as far as the mRNA is concerned. It's exactly the same sequence. The difference is the lipid coating that's on the outside. Moderna has a little bit different. Moderna has a little bit different lipid coating. It's kind of fat cells that surround it than the Pfizer one does. So as far as altering your DNA, everyone, you have to go back to your science, but messenger RNA is what's in those vaccines. It is not RNA and it is not DNA. The messenger RNA would have to go back twice. You would have to have a reverse transcriptase to take mRNA back to RNA and a reverse transcriptation to take it back from RNA to DNA. And to our knowledge, and a lot of science from Watson and Crick on has gone into seeing if those things occur, and it does not. It has not ever been shown to do that. But I will tell you this, COVID-19 incorporates itself into your DNA. That's how it propagates. And so it's important to know that. Now, as far as the J&J vaccine is concerned, that is basically just a protein molecule stuck on a virus. It has no ability whatsoever to go backwards and become RNA or DNA at all, because it is just a protein molecule, no different than any other antigen or anything that you might react to in the environment.
And I'll add to that the mRNA is destroyed within days. in your muscle cells. So it doesn't hang around or do anything. In fact, people think it may be associated with what's called the 7-day itch. When you have a little red spot where you had your vaccine administered, that can be the destruction of that. So it's destroyed by your body as foreign.
Okay. That's a good segue into the next one is, we have a lot of questions about what are the side effects from the second dose and why are people not feeling well after the second dose?
I would say that, Kate, is the number one thing that people ask us at these vaccine events. They're really worried. It comes down, you're under the gun, you're getting your shot, and oh no, am I going to feel bad? The doctor's first answer is not as bad as if you had COVID. But the real answer is nobody wants to ask for something to happen to them. So what are you going to look forward to? Well, the first thing is it's a shot in the arm. It's like your tetanus, it's like your MMR, it's like your flu shot, and it's a needle. So yes, there's arm discomfort. And if it feels pretty solid the next day, you're having a vigorous immune response. I think David and I tried to compete who had the more vigorous immune response as we started to feel those aches in our arm after our first injection. The second one, well, it hit me harder than it hit him. So I bragged a little bit, but that put me on the sofa. I did go ahead and take some Motrin. I did go ahead and take some Tylenol, and I didn't feel very good. But that, again, that virally feeling that you get, it's transient. It lasts for a day, maybe, and it's passing. And it's certainly different than what happens with COVID-19. And of great interest is what people talk about is having their vaccine after having COVID-19. And they sometimes feel that vigorous response with their first dose. In our experience over the past couple months, we're also seeing those people not having an even ramped up more event with their second dose. And so you shouldn't be afraid of getting that second booster shot. In all reality, that second shot that you get, it won't be worse than the first if you've had COVID-19. And so again, the bottom line is this little bit of aches and pains for a day, maybe, a lot different than having COVID.
There's also one thing to add to that too, is that some people have asked me if they didn't get that ache or they didn't feel bad after their first or second shot, is their immunity going to be as good as the person that was laid out on the sofa? That's actually been studied, and they've looked at the T cells and the antibodies, and there's no difference. So some people just react more than others do.
Or I was just a weenie.
That's very helpful. Another question is, around getting the second dose and what the availability is in our community. I know we've had some events for 1-to-1, but in addition to that, where our second dose is available in our community, not just for our educators, but also for their families.
Walmart is particularly very active in the community. Of course, the health department does Pfizer. They are talking about adding a Moderna side as well. Not sure about the J&J yet. Clinica Medicos is fairly active. I think Memorial Hospital does a fair amount in our community. Anybody else, David, that you can think of? There's a couple other pharmacists. I believe CVS doing it now.
Yeah, the J&J vaccine, they've had it as well as Moderna at Access Pharmacy on Access Road, and they've had an event with the J&J. The J&J hasn't come out as quickly as we had all hoped, and I'm not sure exactly why that's in the pipeline where it is, but I love Moderna and Pfizer's vaccines. There's plenty of vaccine out there. You might have to do a little work to get to that. And of course, we have tried to do everything we can to make sure we arrange for that second event. We know life gets in the way, and that second vaccine might not fall at a time that you're even free or you've got something else that conflicts with it, but it will be there. And I think it segues into a great question. Then if you didn't get your Moderna at 28 days and you didn't get your Pfizer at 21 days, what should you do? Should you scramble and be scared? You really shouldn't. We feel that you probably can even wait up to 6 months to boost if you had to, but I do not recommend that. Ideally, you no more than twice the recommendation. So 42 days for the Pfizer and no more than double for the 28 days for the Moderna. is what we'd recommend.
And on your second dose too, I think, assuming, but making sure to get the same manufacturer, right?
Yes, you would. You would.
Because some of those different places have different ones.
They do. And honestly, if you did get a boost with the second one, I don't want you looking for this, but and that is being studied. We're looking at studying using one vaccine platform and another. We do not have the results of that, but honestly, probably would work.
Great. Okay, we got an additional question in here that is around needing to wear masks when you get your second COVID vaccine, and if that will also apply to teachers. That's a two-part question. There's one for Hamilton County and one for the doctors.
Well, we're still under a mask mandate for our county, so that's one answer to that question. Second is until if you're in an immediate family and both of you or your whole family is vaccinated, complete vaccinated, then you don't have to wear a mask. But otherwise, you don't know who's been vaccinated or who has not been vaccinated. So therefore, there's still considerable risk.
And I'm going to amplify what Keith said with one public health comment, and realize I don't have my MPH, but a lot of what's going on with the pandemic is in the interest of public health. And since you don't know who has been vaccinated or who has had COVID, or frankly, who has an underlying condition that puts them at high risk, right now, until everyone has had the chance to get a vaccine and have that 2 weeks go past their second shot, we really need to keep wearing our masks and protecting them. It's not so much all about us. I mean, it has been somewhat throughout the pandemic, wear your mask to protect others. And we were along the crowd saying, no, it protects you too a little bit. But once you've been vaccinated, you feel that sigh of relief, you feel that elation, and you have more freedom to do the things that you might want to do. That being said, we're going to keep our masks on here until everyone who's wanted a vaccine has a vaccine.
All right. Well, we don't have any additional questions. I spoke too soon. One just came in. It's someone who had lingering symptoms after having COVID and completing the vaccination. Are there any medical links indicating improvement for people in situations like mine?
Yeah, I'll start the answer.
Go ahead.
Yeah, there's been recent studies showing that the long haulers, folks that had long-standing symptoms, did improve after getting their completely vaccinated. David probably can quote the article a little bit better.
Yeah, it's a complex thing, and it depends on your definition of long COVID. But we lean a lot on the Public Health England because they have so much data on this, and they collect their data substantially. And believe it or not, even kids, 15% are considered to have long COVID, and up to 30% of adults are considered to have long COVID. And that means that you've got one or more symptoms over 5 weeks after your COVID event. There are some hopes out there that there's some medication, steroids and things like that will help. And we've seen a 30% reduction in the rate of long COVID or help with long COVID with people who have been vaccinated. But it takes a full vaccination regimen to get to that. There's a really good article that just came out in Nature. Literally, it just posted yesterday, I believe, and it details all of the symptoms these poor people are dealing with. And they're not small. The OR director at Park Ridge Medical Center, who's a close friend of mine, she's been a nurse there and worked with me since I got out of residency. And she had COVID-19 in December before the vaccines. She still, to this day, when she gets in her car, she can't go to work. When she gets in her car, she has to really think about how to drive to the supermarket, some days can walk a mile, other days she can't even walk across her house. She said she's lost at least a third of her hair. It's fallen out. And unfortunately, she was unable to get the vaccine because they weren't out yet, and it didn't prevent her from having it. She's now due to get her second vaccination this week, and I'm hopeful that she's going to get some resolution of her symptoms. I'm terrified of long COVID. Lisa's terrified of it. We have done nothing but protect our youngest because she was unable to get vaccinated, because we don't want her to get long COVID. And we're so thankful the governor is opening up April 5th from age 16 and on to get vaccinated.
Right. Any additional words you want to share with the group?
I want everyone to ask more questions. If the 30 participants on this call are hesitant to get a vaccine, I want to know why. I want to address those concerns, and I want you to ask the question. I live in this community. I love Chattanooga. I'm not going anywhere. I care about the health of this whole community and those people here, and I want to help make this place safe. I believe in these vaccines. I think they're safe. I think they're probably the most studied, and the two platforms, the Moderna and Pfizer, I think those are going to be the vaccines of the future. I think everything we do is going to be based on that platform. I think it is that good. We have never had a vaccine with 95% efficacy. We've never had that. And it is absolute. God has sent us an unbelievable ability to prevent a horrible disease. And I want people to really think about it. It's a personal decision. And I know that you're going to have to make that on your own. But I'm not Dr. Fauci. I'm not Barbara Burks. I'm not somebody on TV. I'm not somebody on Facebook. I'm a doctor in this community. You can, my office is on Riverfront Parkway. You can come yell at me if you're not happy with your vaccine. I'm happy to take that. But I want to answer those questions if you have them.
We did get
there was
one. Sorry, go ahead, Dr.
No, you got it. I was just saying there was a question that popped in the box.
Yeah, and we sort of touched on it earlier, but one hesitancy may be, can the vaccine give you COVID? That they know people who have gotten COVID after their first or second dose.
The vaccine does not give you COVID, but you can still get COVID after receiving the first dose, especially within the first 7 days after the first dose. You're still largely at risk. And then even after the second dose, it is 95% effective. It's not 100%. So there is a very small chance you can get COVID after receiving both doses.
And I see that question is, having a fever of 103 for a while after the shot. And, some people do have that vigorous response. Those fevers, those virally feelings, clearly people who've had COVID may be actually being boosted by their primer shot. And so vaccines are meant to induce your immune system, and part of your immunity includes fevers and things that give us body aches and joint aches. And so when you see it, some people just have it more than others. And maybe one day we'll understand why some people have it more than others. Right now, we don't have the ability to predict that. But most of the time, it's self-limiting. The longest reported is 4 days that I'm aware of, and the majority of them are less than 36 hours, starting at about 6 hours after your injection. And that's pretty predictable.
I'll tell you, the COVID hit me like a ton of bricks. I've been practicing a long time. I'm 22 years in Chattanooga, and I've lost 10 patients now to COVID-19 that I know of. And I'm sure I don't know all of my patients that I've lost. My scheduler in my office, her dad is Phillip Street. She won't mind me saying that. Of course, a lot of you probably know Sheriff Street. He battled this thing for about 2.5 weeks and died with COVID-19, and literally just 60 years old and obese, but no other comorbidities. And I want to do everything I can to keep that from happening. And the thing that just floors me is that we have this treatment, this prevention in hand, and to have someone die with COVID-19 now when we have this prevention in hand kills me. But I will tell you this, because there's a great question about getting COVID-19. It is, if it's Moderna or Pfizer, it's about 95% efficacy with it. So yes, in that first month, you can get COVID-19. Matter of fact, 5 out of 100 can or will if they're exposed to it. But if you take that data and you look at it 50 to 70 days from now, it's zero. I mean, it is absolutely zero. They're not getting it at all. They're not even getting asymptomatic COVID. And you get plus 70 days, it's absolutely amazing. And the press wants to paint this picture about how bleak it is and, all these variants and all this other stuff. Even these vaccines that we talk about, it's a great thing that Lisa just put up, but it is amazing what this vaccine does when you get out 70 days. The amount of immunity that you have and the protection that you have from it, and that includes the variants. It includes the variants.
Right. We haven't gotten any additional questions. If y'all have anything else you want to share with the group, please feel free.
Just one general question. You all may know this off the top of your head, but the vaccination rate in our community in general, as far as those that have that are eligible, and so we got an entire community. What are you all seeing from a medical standpoint as far as vaccination rates, ballpark?
From the eligible population, it's right around 55%, I believe, is what we're seeing.
I know the United States as a whole, I believe there's 110 million vaccines have been put into arms thus far. And correct me if I'm wrong, Lisa, it's 85 million that have had are completely vaccinated, both doses.
There's something like that. Now, we do have pretty good data on Tennessee itself, not for the county, Brian. I don't know the county statistics exactly because of the intervals at which they report. But out of our state, we've got 21% of people vaccinated. Out of eligible ones, they don't post those statistics. I'm sure we could sit and do the math. We've got only 11% of our state fully vaccinated. And we're learning that there's a tremendous amount of vaccine hesitancy. And that's why, from a health standpoint, we're going to try to vaccinate as many people as possible. And these phases are opening up because the people who are waiting or choosing not to be vaccinated, there's people with their sleeves rolled up. And, I was one of them on the front end. I would have taken these vaccines back in May when they talked about them. We knew the science back then, and we've been waiting for them. We would have entered in the trials if we would have gone to do them. I mean, they are the way to end the pandemic. And so I encourage you that if it's within your ability to go ahead and get your vaccine, I don't see a downside to it. There aren't any right now.
Yeah, the one thing that comes up, that the question was asked early about waiting after you've had COVID-19. I encourage you just go to the CDC. They say do not wait. I don't know why some physicians have told their patients to wait 90 days. That's jumbled up information as far as I'm concerned. We feel that once you've had no symptoms and you're over your COVID, that you should go ahead and get vaccinated because of the immunity that's there. And there's one thing that's really clear, and it's a lot of us have listened to the national press, the national doctors, and there's been COVID has separated patients from their physicians. There is no doubt about that. We've got masks on. We're doing telemed. You're not going to go see your doc for a scrape or a scratch that you might have before, even a sore throat because of fear, and you don't want to go to your doctor's office. And I get that. And normally, if it's time to get your shingles vaccine, I'm old enough for that. I go see my doctor, and he sits down and says, "Hey, it's time to get your shingles vaccine, and this is why." And so I have a lot of trust. I've got built trust with my doc because he's taken care of me for so many years. And we don't have that right now. And so everybody's getting their information from Facebook and Twitter and the national doctors on TV, and there's mixed messaging and all those things. And I can't break that. I'm not most of y'all's doc, but I am. So I kept pointing out, I am a physician in this community. My office is on Riverfront, and it's not an advertisement, but I want you, if you've got questions, you can knock on my door. I'll stop what I'm doing. I'll answer those questions about COVID-19 and this vaccine.
Yeah, I'm right upstairs from David, and if you show up at my office, I'll send you downstairs to David as well.
All right, Dr. Johnson, we'll turn it back over to you if you want to wrap us up.
Absolutely. I did see one last question pop in, and it asked about side effects with a person, what side effects would a person experience if they are taking different prescription medications. Medications are likely to be an interaction.
No, there's no interaction between the vaccine and any medicine.
All right. Well, we sincerely appreciate Dr. Bruce, Dr. Smith, Dr. Helton, you all just being our partners through this, and obviously, more important, I think, is was shared, really making sure that our community at large, obviously our school community, and we're going to share this via our social platforms, but that people that have questions get their questions answered. We fully recognize that our area of expertise is around education, and this has been a unique moment where health and education have converged at levels that are just unbelievable. This 45 minutes that I've spent, I've learned even more than I thought I could consume in the time. That's because of the knowledge that you all have around the content. So is there anything else you'd like to share as we get ready to take it away?
I think it's important, if people continue to have questions and want some sort of outlet, we should coordinate an email response platform. And we're happy to do a coordination of the responses for that. If Jen and Ashley want to work on that one.
Absolutely. We'll work to get, it's a great question. We'll work to get a general email set up where folks in our district can just send general questions that they may have, and we'll figure out how to get those answered. Absolutely.
Hey, Dr. Johnson, thank you for your leadership, and Kate for organizing this. And Ryan Ledford has been at every one of those vaccination events. He's been working his tail off. I appreciate all of you guys.
Thank you. And Jen Bronson as well. I know it's your name on there too. Anything, Dr. Smith?
There.
Yeah. Well, again,
Oh.
thank you all. Yeah, go ahead.
Brian, I wanted to say thank you for having us. This is so important, and if we need to do it again, if this is a desired interaction, we're glad to do this and share what we know, because as I found that your list of questions, they're the common list of questions. We've got these answers for you folks, and that I need to tell you guys that are on this call, you're not alone. These are the questions that we hear each time. And I hope that we've answered them adequately for you. And let us know if we haven't, because we can fill in the blanks for you.
Thank you all very, very much. And thank you all for those that have tuned in for tuning in. And again, we will continue to share this going forward, because we know there are many that have these very same questions, and we want to make sure that we answer them all. So thank you all for making time, and hope you have a great evening.
Thank you.
Thank you.